And the Senate Public Health and Welfare Committee will be called to order. Thank you, everyone, for getting out in this nice weather we're having today. And before I forget, today is actually Heather Braum's birthday as well, so she gets to testify. And what other way to celebrate your birthday than coming before the Senate Public Health and Welfare Committee to testify? So Heather, happy birthday. Committee, first on our agenda, we have a hearing on Senate Bill 407. So we will open up that hearing. And with the Revisor's Office to give us the bill overview is Jenna Moyer.
All right. Thank you, Mr. Chair, members of the committee. Senate Bill 407 would make updates concerning the State Children's Health Insurance Program, which is often referred to as SCHIP. Under current law, there is an 8-month waiting period. If you are a family that has an income over 200% of the federal poverty income guidelines, you have to wait 8 months. If you had previously comprehensive health insurance through a health benefit plan, and it would also, and it would eliminate that waiting period. Additionally, current law ties income eligibility to the 2010 federal, or to the, sorry, for years 2010 and afterwards, it ties eligibility to 250% of the 2008 federal poverty income guidelines, and this would change that to be reflective of the current year's federal income poverty guidelines. I'll be happy to answer any questions.
Committee, questions on the bill? Senator Stephan.
Thank you. Can you give us any past history, or do you know any of the past history on how the 8 months began in the first place?
Unfortunately, I don't know the history of why the 8-month waiting period was initiated. Maybe somebody in the audience might, or I can look into it additionally, figure out when that provision was put into law.
Yeah, I think if none of the conferees have that, maybe we can get that distributed to the committee. So, committee, not seeing any further questions. Jenna, thank you. We will now move to proponent testimony, and our first proponent is our very own Minority Leader, Senator Kdhe.
Thank you, Mr. Chairman. Senator Hildebrand, Senator Gossett, who's not here, and my public health welfare colleagues, thank you for the opportunity to speak to Senate Bill 407. You have my testimony. It's not very long, but this bill, Senate Bill 407, is a common sense technical fix bill that addresses a mistake in statute dating back to 2008. The bill corrects the issue so Kansas is back in alignment with federal regulations for the Children's Health Insurance Program, better known as CHIP. Kansas is the only state with language referencing a specific year for federal poverty level for CHIP, and nowhere else in Kansas statute concerning federal guidelines is a specific year mentioned of the relating to the poverty income. So this is taking care of a error that occurred in 2008 with the legislation, and does help to address the waiting period and also the eligibility. And it should be noted that participants receiving coverage contribute to the payment for coverage on a sliding scale based on ability to pay. And so removing the date of 2008 will correct the eligibility block for Kansas families. And I'll be glad to stand for questions at the appropriate time.
Senator Kdhe, if you don't mind, while you're up there, we'll go ahead and open for questions for you, and then we'll continue with the rest of the proponents and let them go through. That way you can come sit down and be part of it. Senator Stephan.
Thank you. Could you help me understand why that's labeled a mistake? Is there data going back to 2008 identifying that as an error in the bill throughout the process of being heard, worked, passed on Senate floor, et cetera, et cetera, et cetera?
So it appears when looking back at the records from 2008 that this occurred in conference committee, and then it was inadvertently left in there and has remained in place. And then when The Georgetown Center for Children and Families was looking at state eligibilities for CHIPS. They helped bring this to our attention as being the only state in the country that has qualifications that tied to a year in statute. And as I mentioned earlier, it is the only place in Kansas statute that you have federal poverty level tied to a specific year. So it does reduce the number of families that would be eligible, because our federal poverty level has increased since 2008. Does that help answer your question, Senator Stephan?
So Senator Petty, just so I understand it, and maybe some listening online, on the poverty level, when it's based off the 2008 poverty level, that means whenever it is adjusted from 2008 to, we're in 22, so that's 14 years later, we're still going, instead of going off the 2022 poverty level, we're still going off 2008 poverty level, correct?
Correct.
Okay, thank you. Senator Thompson.
Yeah, one quick question on the part that was stricken on page 2. I think it's down around line 9. It says, this waiting period provision shall not apply when the prior coverage ended due to loss of employment. So by striking that, somebody, okay, it's been a long morning already driving in snow. Somebody who lost their job, the waiting period provision shall not apply when the prior coverage ended due to loss of employment. So in other words, by striking that, they're eligible immediately? Or anybody, let's say somebody didn't lose their job. They had a job, but they were at the 200%. Clarify that for me, because I mean, obviously we don't want people just quitting their job so they can qualify for certain things. You see what I'm saying? I guess. I'm not sure what I'm saying this morning. I'm a little fuzzy yet.
You probably did have to drive in, so.
Yeah, I did. That snow kind of put me to sleep.
Senator Thompson, if it's okay, I think Jenna has an answer for you.
Okay, perfect.
Thank you, Mr. Chair. So the waiting period currently in statute already does not apply if a person were to lose their job other than for voluntary termination. And just a reminder, this is not for the individual who lost their job, the adult, it would be for the children. And this would make it so no matter what reason you do not have insurance, there's not a waiting period for your child to get state health insurance coverage if you meet the income guidelines.
Income guidelines.
Okay. All righty. I think I got it clear in my head now. Thank you. Thank you, Jenna.
Senator Stephan.
Thank you. Well, now you confuse me. And maybe Jenna can clarify this as well. So we went from a situation where if you quit your job, you had an 8-month waiting period, to now you can abandon ship and immediately qualify for insurance.
Jenna.
Thank you, Mr. Chair. If you quit your job and you do not have insurance through maybe your spouse's insurance coverage and you meet those federal income poverty guidelines, then your child would be eligible for state health insurance coverage. And I looked it up. The 2008 federal poverty limits for a family of 4 would be about $21,000, and in 2022, it's about $27,750.
Okay, I do not see any further questions. Senator Petty, thank you. Thank you. Committee, our next proponent testimony is Heather Braum, Health Policy Advisor for Kansas Action for Children. Heather, welcome to the committee.
Sorry. Thank you for the opportunity to share our support for Senate Bill 407 in regards to some technical fixes to the Children's Health Insurance Program, or CHIP. My name is Heather Braum, and I am the Health Policy Advisor with Kansas Action for Children, a nonprofit advocacy organization working to make Kansas a place where every child has the opportunity to grow up healthy and thrive. CHIP extends health insurance options beyond Medicaid to families in Kansas. Many working Kansas families who struggle to afford health insurance for their children can qualify, depending on income levels, for CHIP coverage in Kansas. A recently discovered error in Kansas statute dating back to 2008 means that through no fault of their own or family income changing, some Kansas children have lost their CHIP coverage. Senate Bill 407 fixes this problem by removing the year-specific language in statute for federal poverty income guidelines and removes a waiting period clause out of alignment with current federal regulations. And I can come back to that during questions if I need to elaborate on that further. When reviewing legislative actions from 2008, as you've already heard, somewhere between the Senate committee version and the final conference committee version passing, this 2008 federal poverty income guidelines phrase was added in error, and the 2008 year reference was never removed in the years following. As a result, even though the upper CHIP eligibility threshold is supposed to be 250% of federal poverty income guidelines, due to the 2008 year inclusion in 2021, this eligibility percentage now translates to 225%. You'll notice a state plan amendment document included at the end of my testimony for what Kansas submits to CMS each year, showing this eroding income threshold. This is the 2021 submitted document. Notice that in 2013, the percentage was already 245%. In 2021, the percentage has now eroded to 225% and will continue to decline until this error is fixed. As you already heard from Senator Petty, Kansas is the only state with language referencing a specific year tied to CHIP eligibility percentages of the federal poverty income guidelines. Furthermore, in Kansas statute, other programs mentioning federal poverty income guidelines or federal poverty levels do not reference a specific year. This statute is an outlier and it needs to be fixed. Should Senate Bill 407 become law, many children in the $50 per month premium paying families who can't afford health insurance from another source could again qualify for the CHIP program. We've estimated that this bill could open CHIP back up to about 47,000 kids. Many of these children may be already insured through another source. Even so, a significant number of Kansas children could be impacted positively by the passage of Senate Bill 407 and give their families options when their children are uninsured. Senate Bill 407 is a technical but important bill for kids and families in Kansas. We urge this committee to pass it out favorably. Thank you, and I'll stand for questions at the appropriate time.
Heather, thank you very much, and we will hold questions until the other two conferees have had an opportunity to testify. Committee, our next proponent testimony is with us virtually, Denise Seisman, CEO of Community Cares. Denise, welcome to the committee. Denise, are you with us? Okay, not hearing anything from her, we will go ahead and move on to Tanya Palmer, Director of Eligibility for Kdhe. Tanya?
Good morning. Thank you for the opportunity to speak this morning, Mr. Chair and members of the committee. My name is Tanya Palmer, and I'm the Director of Eligibility for the Kansas Department of Health and Environment. It's a pleasure to stand before the committee as proponent of Senate Bill 407. This proposed legislation updates includes provisions that we believe will be beneficial to our KinCare applicants and to Kdhe as we administer the CHIP program. I'll highlight two specific provisions outlined in the bill as part of our testimony. Section 1B8 would remove outdated language requiring CHIP applicants to wait 8 months before being enrolled in the CHIP program. And as others have stated, this is if they voluntarily dropped other comprehensive health insurance. Our agency has been unable to enforce this 8-month waiting period due to the passing of Affordable Care Act legislation. Updated law required us to make updates to our eligibility program policy to align with the federal law. The proposed updates to Senate Bill 407, removing the waiting period, would allow the state statute to match our current eligibility policy. I'd also like to make mention of Section 1B7 of the bill, which would place the CHIP eligibility limit at 250% of the federal poverty level. As mentioned, the current CHIP eligibility limit is set at 250% of the 2008 federal poverty level, which after some calculations, you'll find that that's approximately 225% of the current FPL. As mentioned, we believe this comparison to a 2008 standard is not only outdated, but it may unnecessarily add to the complexity of understanding our eligibility income guidelines. It's also a bit of an administrative burden to our state staff as we have to, year after year, perform this analysis and calculation to translate the 2008 standard to current FPL levels. In closing, overall, we believe the changes proposed in Senate Bill 407 would allow us to operate a more effective CHIP program for our Kansans that are in need. Thank you for your time, and I'm happy to answer questions when appropriate.
Tanya, thank you. Zach, is Denise Seisman online yet? Oh, it's written only. Okay. Okay, so we are, committee, we do have 6 written only proponent testimonies. And at this time, we will open up questions for conferees. Senator Thompson.
Thank you, Mr. Chair. And this is for Tanya. Quick question. You know, we've got, say you have a situation where somebody lost their job, but maybe turns around and gets another job 30 days later. Is that income level based on their monthly income or their annualized income?
Great question. Their income is based on their monthly gross income. So we determine eligibility based on the gross monthly income.
So if they lost their job, their income goes to zero, they automatically qualify, correct?
Yes, they would qualify for eligibility if that was the only income source in the house. With zero income, though, they would likely be eligible for Medicaid and not CHIP.
What I'm trying to get at is, say you have a situation, somebody loses their job, the kids become eligible, you sign them up, and then they go get a job, or that other person, you know, the sole income earner gets a job, say within 30 days, does that immediately, and it's above that 250% threshold, is there an administrative issue that you see where you're signing kids up, dropping them off, or once they're on there, can you drop them off once the parents are disqualified because of higher income level?
Yes, so once they are determined eligible for Medicaid or CHIP, the children, we continue their eligibility until their review period, which is usually 12 months later. So any changes between their initial approval but through their review period would not affect their eligibility. So in your scenario, if the family, the sole income earner, got another job 30 days later that placed them above the income guidelines, we would allow the child to maintain their eligibility through their review period.
Would it make sense to you then, I'm sorry, Mr. Chair, is it okay? Would it make sense to you then perhaps to have some kind of a waiting period? 8 months is maybe too long, but perhaps maybe 30 or 60 days so that we don't run into that type of situation and you sign up 2 or 3 kids and then, you know, to me, it makes it more difficult to manage our budget because then you've got kids on the program for an entire year rather than having that situation. I'm just curious how, if you think that maybe it would be easier to maybe extend a little bit of a waiting period so you don't have those situations and it makes it easier to manage the state budget.
Right. So we would not allow CHIP eligibility if the family does have comprehensive health insurance and their income falls within a certain range. So what we would be eliminating is the waiting period should the family get denied and then later apply without the health insurance. I think it'll be beneficial to our agency and the families if we not apply a waiting period, but that's certainly something that we can monitor to see if, there's abuse of the policy if we move forward.
Thank you, Mr. Chair. Thank you, Tanya.
Senator Stephan.
Thank you. Help me walk through all the different programs we've talked about here. We've got Medicaid for our truly indigent. Now we've got CHIP is kind of is the next program in line. Where does Obamacare, I know, falls in that same category somewhere? Help me understand if there is overlap, where that overlap occurs, and if so, why do we have redundant programs?
I don't know that there is any overlap. Our eligibility for children is based on what we call MAGI rules. So it's based on the income of the family, based on how they would file taxes. And I believe this is a law that was in place following ACA legislation. So to answer your question, I don't believe that there is overlap between our programs. It's income based, and the child would fall within, the eligibility program based on the income of the family.
And Tanya, correct me if I'm wrong, I think part of the confusion is when you threw in Medicaid and the Affordable Care Act. So Medicaid and CHIP are all based off of the poverty level. But Medicaid could be not just for children, but it can also be for adults. CHIP is specifically just for a child, correct?
That's correct.
Thank you. Senator Erickson.
Thank you, Mr. Chair. Thank you, Tanya. I want to go back to Senator Thompson's question and just add one more little piece in there. He said that if someone loses their job, then this would be the situation. And I know we talked about this earlier, but would that be if someone voluntarily quits their job? Immediately, their children get on, could be eligible for CHIP according to the guidelines for a year. Am I understanding that correctly?
So if the parent loses their job, or if they voluntarily or involuntarily, they're no longer employed, we would consider their income based on that point in time, and the child would be eligible. Does
Thank
that
you.
answer the question? Okay, you're welcome.
Yes, it does. Thank you. Thank you, Mr. Chair.
Senator Petty.
Thank you, Mr. Chairman. I hope that we keep in mind that we're talking about children, and we're talking about, for the most part, we're talking about working families, not someone necessarily voluntarily or involuntarily losing their job, although this does it helps to ensure that they continue to have, that they have the opportunity to have health insurance for their children, even if they are no longer employed with a company that might provide health insurance. But I think we should also keep in mind that there are many, many people that are working poor that have no benefits with their job at all, whether they are self-employed or whether they are working for somebody else. They do not have that opportunity or cannot afford it, but this does allow within their income level for them to have their child to have insurance. And the main basis of this bill is removing the tie to 2008. And that is 14 years ago. And we no longer, and there is no other place in Kansas statute where we tie the federal poverty income guidelines to 2008. So I know we haven't spent much time in this committee talking much about federal poverty levels or some of our programs, but I think it is important that we want to have them available to as many families as possible who meet their guidelines of 2022, not 2008. And I would ask if Heather, could you, since Denise was not on here, Denise Kuzman, she had mentioned in her testimony about our safety net clinics and the impact that this could have on the families that they serve.
I haven't had a chance to review her testimony, to be quite honest, and safety net clinics are her area of expertise, so I can't answer that question, Senator Petty. But if I can I address the waiting period part just very briefly? That came to our attention in the process of drafting this bill that, I can't speak to the Affordable Care Act connection to that. I was under the impression that federal regulations changed for CHIP around a waiting period. And so 2.5 years ago, my understanding is the Kansas Medicaid program submitted a state plan amendment to the federal government that was approved in December of 2019, removing the waiting period. So what we have here is statute is out of alignment with federal regulations in this policy that's already been approved. So I can't, get into, again, going back to the Affordable Care Act and where all that was. That's outside of my scope of knowledge right now. But I'd be happy to dig into that a little bit further with our experts at the national level if needed.
Heather, you might be able to answer this question, or Tanya, if you cannot. It seems like the concern, and I could be reading the room wrong, and it's kind of a concern I have as well, is I don't think anybody has a concern so much over if someone lost their job, but if someone quit their job, that seems to be a concern. And the way, if you strike Section 8, or not Section 8, but what is it? Paragraph 8, it then would allow over 200% if someone quit their job. Would we still follow the federal guidelines if we put that line back in, but struck everything except for voluntary termination?
I would need to defer to LaTanya to answer that question. But also I can look into that further if needed.
Tanya, do you have the answer to that question?
I would need to look into that also, Chair, if that's okay. I can take that back and look into it. I don't have that answer right now.
Yes, if you would, because that seems to be a very big sticking point to a lot of the committee members and myself included in that one. So if you can get that back to us, that would be greatly appreciative. Senator.
Could you say again what line you were talking about?
Page 2, starting on line 3 to 14. Senator Thompson.
I just want to clarify, if we were to do that, and I would be fine with that, actually. I thought they were talking about changing the level to 250% of poverty line. Am I correct in that, or just updating the date and leaving it at 200%? Is that what we're doing with that?
So currently you have two different percentages of the poverty level. So the initial part is the way our statutes are written now. To qualify for CHIP, you have to meet the 2008 250% of the poverty level.
Okay.
So being 2022, it's kind of outdated.
Right.
So in this part this is just relates to the waiting period of 200% of poverty level, then you would have the waiting period.
Okay. So I guess what she was saying, and maybe Tanya could answer, would be if the federal government struck the waiting period and we decided to change the waiting period to a shorter time period, say 30 or 45 days, would that affect the federal funding? So we could make those changes on our own. Is that correct? Without I'm trying to figure out, because you're working with federal, CMS standards and what the state is able to do without violating those.
And Senator, I think that will be part of what they will research and get back to us on, so.
Thank you. Thank you, Mr. Chair.
Okay, Senator Steffen.
A couple of quick comments. Number one, it's everybody's goal to have a strong social safety net, but this program's clearly up the line a fair ways. And secondly, us writing our laws to correspond to federal regulations, that's caused us a whole lot of trouble the last 2 years. And I really would pray that we could learn from our mistakes over the last 2 years and do a better job of circumventing them. I do not feel the least bit compelled to write Kansas law based on federal regulation.
Senator Petty.
Thank you, Mr. Chairman. The 2008 is something that's in only this particular statute in relation to only one program, and that's CHIP. And that's us, that's not federal guidelines, that's Kansas having in a statute tying eligibility for a program to 2008 federal poverty level. This is 2022. So that's one of the main focuses of this bill, correcting that error. And once a child is eligible, they are beneficial of the CHIP program for 12 months. That's already in place. So I hope that we would keep in mind about the correction is not related to federal law. It's related to something that's in our statute that makes little sense when we talk about, this is not 2008, this is 2022. And I think we would want all of our statutes to be up to date and connected with the current year and not with a past data. The other part I hope we would keep in mind is that we're denying Kansas children the opportunity for health care. And that, to me, should be of top concern for all of us.
Senator Erickson.
Thank you, Mr. Chair. And I would say that I don't know if anyone, but I'll speak for myself, wants to see children not get the care that they need, regardless of the situation in their family. However, I would say if a parent has a job and they have health insurance for their family with that job and they quit that job, that's not the state denying those children insurance. That's on the parent for not keeping that job to provide that coverage for their children. Thank you, Mr. Chair.
Not seeing any further questions, and we will close the part on proponents. We do not have any opponents or neutral testimony. So with that, we will close the hearing on Senate Bill 407, and we will now move to Senate Bill 440 and open the hearing on that bill. And with the Revisor's Office to give us a bill overview, Jenna Moyer.
Thank you, Mr. Chair, members of the committee. Senate Bill 440 provides updates to the Occupational Therapy Practice Act, and it would authorize occupational therapists to provide limited services to patients without a referral. And it would allow, under these limited circumstances, for an occupational therapist to begin treating a patient without a referral from an outside physician. And then it provides exceptions that if there's not progress being made, or that a person keeps coming back and coming back and coming back to receive the same services, that an additional referral would be required.
Oh, I'm so sorry.
Sorry, cord. And then it provides just some updates to definitions in KSA 655402. And it adds the definition of practice of occupational therapy to not include any branch of the healing arts or the making of a medical diagnosis. And I can go over these specific reasons why they wouldn't need a referral, or I can just answer questions.
Jenna, I think we can just answer questions, but I guess the question I would have for you is, do I have to sign off on that hazard pay for you just now, or is that something that's automatic?
Didn't fall, so I don't think it's a workers' comp liability just yet.
Committee, do we have any questions for Jenna on the bill? Okay, not seeing any, Jenna, thank you. Committee, we have one proponent, oral testimony, no written, Travis Grauerhouse with Kdhe. Travis, welcome to the committee.
Stepping into the hazard zone here, apparently. Mr. Chairman, members of the committee, my name is Travis Grauerholtz, appearing today on behalf of the Kansas Occupational Therapy Association. With me today, I also have Bryan Mills, who is president of Kdhe, as well as an OT at KU Med. The Kansas Occupational Therapy Association was founded in 1972 and consists of 450 members of Kansas occupational therapists, occupational therapist assistants, and students. Thank you for the opportunity to provide remarks on Senate Bill 440. Over the past couple of years, we have had internal discussions within Kdhe on how we could provide better services to individuals. We believe that these updates in this legislation would allow us to do that. Currently in Kansas, OTs are only allowed to evaluate and offer services to patients referred to them by a licensed physician. The bill would change this process to allow OTs to offer those services without that referral. These services that would be able to be offered to the public for the purpose of health promotion, education, and functional independence and activities of daily living. Employees solely for the purpose of education and instruction related to workforce injury prevention, and special education students who need occupational therapy services to fulfill the provisions of their individualized education plan or individualized family service plan. I want to be clear, this does not completely eliminate the referral process. As Jenna already mentioned, if a patient is not progressing towards documented treatment after 10 patient visits or 30 calendar days, or is self-referring back to the OT for a issue that was previously thought to be accomplished within a year, that referral process would kick back in and the occupational therapist would no longer be able to provide or to continue that treatment until that referral is given to them. Another change the bill does is adds in the requirement for OTs to maintain liability insurance coverage to be licensed in the state of Kansas. Currently, OTs and OTAs are not required to hold liability insurance. However, it is strongly recommended, and a lot of the OTs and OTAs do have that insurance right now. This would just put in requirement that they would have to have that to be licensed in the state of Kansas. And lastly, the bill would allow the ability for OTs to perform wound care management. However, this would only be after the approval of a person licensed to practice medicine and surgery. This would not fall under the limited direct access. So an OT would not be able to provide wound care management without that referral. We believe these changes to the OT scope of practice will better serve the Kansans and help them gain that access to our services quicker. We respectfully ask for your support on Senate Bill 440, and I'm happy to stand for questions at the appropriate time.
Travis, thank you. And now is the appropriate time because you are the lone proponent testimony, and we do not have any written proponent testimony. Committee, do we have any questions for the proponent? Senator Petty.
Thank you, Mr. Chairman. Travis, thanks for being here. I was noticing in the bill, also on page 3, line 3, where it is very clearly defines the practice of occupational therapy, so that if there's a question about how they're practicing, is that there to spell out specifically that they are well, it says they're not including the practice of any branch of healing arts are making a medical diagnosis?
Correct. We actually ran this language by KMS and worked with them on it, and that was a suggestion that we put in there to make sure that it is clear that occupational therapy does not include any practice of the Board of Healing Arts or making a medical diagnosis.
Thank you.
Senator O'Shea.
Thank you, Mr. Chair. I would just love like an example or two of how you see this working with patients. Thank you.
And Mr. Chair, if you don't mind, I might be, if I could defer to Bryan, he might be able to give a bigger in-depth on, the patient care and how moving forward this would help them.
Sure, just state your name, who you represent.
I'm Brian Mills with Kansas Occupational Therapy Association. Thank you, Mr. Chair, for having me, members of the committee. In this situation, it would look different in different parts of the state. Where I am at, I'm in an outpatient setting. I am one of a few disciplines in that setting. I have folks come through the door that would have a ailment that I specialize in hand and upper extremity. With a referral, typically a physician would end up writing what is a physical ailment. They would end up writing a script for physical therapy, whereas I would be the go-to person as a certified hand and upper extremity person to deal with that. That would delay care, as I would have to contact the physician, get the proper signature. It may take a day, it may take a week, it may take 2 weeks. It just depends on the setting. In a rural setting, some of our areas in western Kansas, we have a similar situation there. Just a delay of care, or that will go ahead, they will get started with the care with another provider that, yes, they can treat that, but they may not be the perfect expert in that area of treatment.
Senator Stephan.
Thank you. One of my tenets in practice was you can't treat something without a diagnosis. You got to know what your diagnosis is, develop a treatment plan. Agreed?
Correct.
Okay. So let's look at this bill. On page 3 there and 2, occupational therapy does not involve making a medical diagnosis. Go to page 1, and it has you treating a patient without a referral from a healthcare practitioner. So are you telling me that what you deduct from those two sentences is you're treating a patient without a diagnosis, and we just established that you can't make a treatment plan without a diagnosis?
Yeah, the diagnosis is a treatment diagnosis. We currently do services in the state and are allowed to under ergonomics, things like that, where we would go on site. We would get a call from an employer, and they would have a neck issue where they're dealing with that while they work. As an ergonomist, we would go out on site, evaluate the setup that they have, see if they're aligned properly, and then give them interventions, whether it be ergonomics or through.
I think a lot of that is covered in the rest of the bill, but again, you have somebody come in with a shoulder problem or hip pain. One of the great ones would be hip pain. And if you can't make a diagnosis, how can you have a treatment plan?
Through our evaluation process, we have a lot of objective assessment tests that we run that are indicative and well reviewed on what they would indicate. Me dealing with upper extremity, I use 2 or 3 provocative maneuvers every day, similar to what a physician would use, that are well documented on what they indicate.
But again, you can't formulate a treatment plan without a diagnosis. I've had people who came in with hip pain and had metastatic cancer to their hip. And so, you really have to have the evaluation and diagnosis before you start treatment.
I've had that situation as well in the past where we would have them in therapy and we would, through various things that we would be focusing on for rehabilitation, has resulted in a vasovagal response that then would be referred back to the physician. And that exact situation happened where they did scans even after the physician referral and found sarcoma. So I understand that.
Senator Erickson.
Thank you, Mr. Chair. Just a quick question. So in this model, then, would occupational therapists then be expecting to file and receive health insurance reimbursements?
Yes, if that was considered somebody that was practicing on their own, then they would be required by insurance means to become a provider through an insurance base. I think the majority of our situation is that a lot of, I mean, I do believe there'll be a small version of folks that would want to go out and start their own practices and agreements with insurance. A lot of ours still operates within many of the health systems throughout the state.
Okay, thank you. Thank you, Mr. Chair.
Okay, not seeing any further questions for the conferees. Thank you very much. Committee, we will now turn our attention to neutral testimony. First with us is Susan Gile. Well, not Susan Gile, it's Courtney Seisman. On behalf of Susan Gile for the Courtney is General Counsel for the Kansas State Board of Healing Arts. Courtney?
Thank you, Mr. Chairman and honorable committee members. My name is Courtney Seisman, and I'm General Counsel of the Kansas State Board of Healing Arts, and I appreciate the opportunity to speak with you today regarding Senate Bill 440. As you are well aware, the board licenses and regulates 16 different healthcare professions in Kansas, and that does include occupational therapists and occupational therapy assistants. At the outset, I do want to recognize that Kdhe, Travis, and Bryan have worked very collaboratively with the board on this bill, and we certainly appreciate that. There are 4 main points that the board does want to bring to this committee's attention related to patient safety concerns. The first is on page 1, lines 14 through 17. As written, this bill indicates what to do when a patient is not progressing. However, there's no clarification on what happens when a patient is progressing. Additionally, the board would request clarification on who is actually making that determination on whether or not the patient is progressing. The second point is on page 1, lines 19 through 21, and this was brought up briefly already, but in the board's opinion, they're concerned that if a patient returns to an OT for something that the OT has already treated and it was resolved, that there may be something more going on medically requiring a medical evaluation, for example, the sarcoma. So while there is this 1-year time limit in terms of the bill as written right now, the board would actually request that in any instance where a patient is returning for the same treatment, that a referral be required. The third point is on page 2, lines 3 through 5. As written, an OT can provide wound care management services so long as it's approved by a physician. But wound care management is not currently defined, and that's important for the patient, for the OT, and for the physician. From a patient perspective, they would need to know if they have some kind of wound ailment. Can you go to your OT? Is this something that they can provide, or is this something I actually need to go to my doctor for? From the OT's perspective, it's important for the OT to know what's within their scope of their practice in terms of wound care management, and at which point it would be going into the level of where a physician would be required. And from the physician's perspective, they need to know what it is they're approving that OT to perform. And then finally, the board would request a requirement that if a patient does present to an OT for a self-referral, that patient's primary care provider is notified. And this is for purposes of continuity of care. I'm happy to stand for questions at the appropriate time.
Courtney, thank you. We will hold questions until after all neutrals. Our next neutral proponent, or neutral testimony, neutral proponent, neutral opponent, they're neutral, not a proponent, not an opponent. They are neutral. So Rochelle Colombo, Executive Director of KMS. And Rochelle, I hate to request this of you, but if you can keep it really brief, that would be great.
I will do my very best. Chairman, members of the committee, I'm Rochelle Colombo, Executive Director of the Kansas Medical Society, and we do appreciate the opportunity to appear before you. And as Courtney mentioned, KOT reached out to us in the summer, KOTA reached out to us this summer and asked for our input on this proposal, and we had discussions and really do feel that what they've put forward in Senate Bill 440 is appropriately limited and does recognize the differences between the role of occupational therapy and medicine. I think an important clarification is that the direct referral is only allowed under certain circumstances. And so it's limited on page 1 of the bill, again, to employees, for workplace injuries, for prevention, the public for the purposes of health promotion and education, special education, students who need help with their daily functional tasks. And so, and then as well as wound care management, they would not be able to do that without the direct referral from a physician. And so we felt that that appropriately balanced the need to, or the opportunity to allow for direct referral while still having appropriate limitations between medical practice and occupational therapy. And really, really appreciate the occupational therapists and group like the pharmacists who've come together to work with us to try to appropriately limit those things. So thank you.
Rochelle, thank you. We do have a question online from Senator Gossage. Senator Gossage?
Yes, can you hear me?
We can.
Thank you. Finally got dug out of being stuck and back at my house. Been listening and thank you very much. My question is about cash payers. So if someone comes in to pay cash, of course, insurance is not involved. Are we saying then that we would want the end of the occupational therapist to then reach out and give a accounting to that individual's primary care physician? Is that what's being requested?
Travis, does someone have an answer for that?
I believe that language, sorry, Travis Crowholtz, KOTA. I believe that language was suggested by the Board of Healing Arts. That question may be better suited for Courtney.
Courtney, can you answer that question?
Sure. So it's not what the board is requesting is not related to insurance or cash payment purposes. It's simply notification to the primary care physician that, hey, your patient has begun OT services pursuant to this referral, just so they are aware of everything that their patient is getting services for.
Thank you, Mr. Chair.
Senator Thompson.
I'm not sure who this is for. Can you just go get occupational therapy on your own without a referral?
So that,
Just curious.
Michelle Colombo, Kansas Medical Society, that's really the change that's being made here is no, you cannot. It requires a physician referral. And this bill would still say that if a hospital or other medical facility wanted to require that physician referral, they can. But in these limited circumstances that are outlined on page 1 of the bill, an individual could now, and if this bill were to pass, they could then seek those services without referral, but not without this.
So, I can see the contradictory language that was brought up by Senator Steffen, because in new section 1, it says, may evaluate and initiate occupational therapy treatment. So if we struck the word evaluate and just let it be initiate, but again, an evaluation would be essentially a diagnosis as lined out on page 3, or contradictory to what is said on page 3 about the practice of occupational therapy does not include the practice of any branch of the healing arts or making a medical diagnosis. Do you see how that
I do see, I think where there's a belief that there's a conflict, what our belief is that this is not contradictory because these limited opportunities that are identified here shouldn't cross over into medical diagnosis. So they are evaluating and treating those 3 specific buckets that don't fall over into medical areas. So that's really the distinction. And really it's on adding that language in about it not being a medical diagnosis, that's just kind of belt and suspenders because what they're doing in those scenarios should not be medically related.
I mean, I understand the need for the bill. I just curious about, you don't want to be able to gloss over something that could be much more serious.
Well, I agree completely. And that is certainly something we would have concern about, but we feel that this appropriately addresses that.
Okay, thank you.
Committee, we are out of time, so we are going to close the hearing on Senate Bill 440. Just as a reminder, we are working tomorrow on bills previously heard. Monday, just to give you an update on Monday, we are going to have a update on Senate Bill 174 and 454 from the reviser. For those of you that don't know what those bill numbers are, those are the APRN bills. And then we are going to allow 5 minutes for an opponent and 5 minutes for a proponent to refresh us, since we had the hearing last year on what their objection and why they support it. And then we will plan on working that bill after. So if you have, please look at those bills and see if you have any concerns or amendments that you would like to have. Make sure you get those to Jenna as quickly as possible. And then the next item, March 2nd, we will have the confirmation hearing for the Secretary of Kdhe. So that is everything as I know it at this time. And yes, you should already have your packet, so make sure that you read through those before then, and make sure you bring those to the meeting on March 2nd. Is there anything else come before the committee? Seeing none, we are adjourned. Thank you, everyone.